In the mid-2010s, the rural town of Worley, Idaho, faced a crisis that threatened its very existence. With a population of just over 3,000, Worley had long been sustained by logging, agriculture, and a tight-knit sense of community. But as industries shifted and younger generations moved to cities, the town began to fade. Stores closed, schools consolidated, and then came the blow that nearly broke it, the announcement that the local hospital, a modest 24-bed facility serving 5 surrounding counties, would shut down due to insurmountable debt and declining patient volume. For the residents of Worley, this wasn't just a medical issue. It was existential. The nearest alternative hospital was 72 miles away in Coeur d'Alene. For elderly patients, emergency care would become a death sentence. For pregnant women, childbirth meant hours of travel in winter storms. For families, it meant one more reason to leave. The closure sparked outrage, protests, and desperate fundraising efforts. A GoFund campaign raised $86,000, noble, but nowhere near the $3 million needed to stabilize operations. Local leaders pleaded with state officials, but with no immediate solution. The shutdown date loomed. What happened next seemed impossible, but it was real. It began with a phone call. In early 2018, Jeff Bezos received a letter from Dr. Evelyn Reed, the hospital's longtime chief physician. She didn't ask for a donation. She wrote about the people, the farmer who drove himself to there after a tractor accident. Because there was no ambulance service, the diabetic patient who walked 2 miles each week. For insulin injections, the newborn delivered in the back of a pickup truck during a blizzard because the roads were impassable. She ended with a simple truth. This hospital isn't just a building. It's the heartbeat of a town. Bezos read the letter personally. Though known for his data-driven decisions, he also trusted intuition and human stories. He had grown up in Albuquerque, New Mexico, where small-town values shaped his early life. He understood that places like Worley weren't just dots on a map. They were homes. Instead of writing a check, he asked questions. He had his team contact Dr. Reed, review the hospital's finances, and assess the feasibility of a turnaround. What they found wasn't hopeless, just under-resourced. The staff was dedicated. The equipment was outdated but repairable. The community was willing to fight, but it needed investment, not charity, but sustainable support. Within weeks, Bezos launched a quiet initiative through the Bezos Day One Fund, which he had announced months earlier with a $2 billion commitment to fund nonprofit organizations, supporting homeless families and innovate new K-12 education models. Now, he expanded its scope to include rural healthcare sustainability. He didn't make a public announcement. There were no press conferences, but through a network of regional health foundations, Amazon's corporate giving arm, and partnerships with telemedicine providers, he funneled $4.2 million into the Worley Medical Center. The funding covered debt restructuring and operational stabilization upgrades to emergency room, and diagnostic equipment installation of high-speed internet. For remote consultations, training for staff in digital health, management recruitment incentives for doctors and nurses. But Bezos didn't stop at infrastructure. Understanding that long-term survival required economic revival, he connected the hospital to Amazon's hiring pipeline, creating remote jobs in customer service and data entry for local residents. He also facilitated a partnership with Amazon Web Services to train young adults in cloud computing skills that could keep talent in the region. Most importantly, he ensured transparency. Every dollar spent was tracked. Progress reports were shared monthly with the community. And Bezos insisted that the hospital remain locally governed, not a corporate project, but a community asset. By 2020, the Worley Medical Center was not only open, it was thriving. Patient volume increased by 40%. Emergency response times improved. Telehealth services allowed specialists from across the country to consult with patients without travel. And the town began to revive. New families moved in. A cough reopened. The school enrollment stabilized. Locals credited the hospital's survival as the catalyst, proof that Worley still had a future. Bezos never visited. He didn't need to. But every year, Dr. Reed sent him a handwritten update, photos of newborns, thank you letters from patients, snapshots of the holiday party in the waiting room. For Bezos, this was philanthropy in the traditional sense. It was systems thinking applied to humanity. He had built Amazon by solving logistical problems at scale. Now, he applied the same logic to social challenges, identify bottlenecks, remove friction, empower local actors, and measure outcomes. And for the people of Worley, the richest man in the world hadn't just saved their hospital. He had restored their dignity. Because sometimes saving a life isn't dramatic. It's ensuring an ambulance can arrive in time, that a child gets vaccinated, that an elder doesn't die alone on a snowy road. And Jeff Bezos, the man who once shipped books from a garage, had proven that the most important deliveries aren't packages, they're possibilities.